Seronegative spondyloarthritis affecting the it is a seronegative spondyloarthritis affecting the sacroiliac joint predominantly. Before that, we have to know the difference of spondylitis, spondylolysis, and spondylosis. Spondylitis is the inflammation of the uh, bones. Spondylolysis is the slipping of the vertebra over one another. And spondylolysis is the break or a defect that is over the break or a defect that is seen over the sacral, that is your vertebra. And spondylosis is the degenerative condition associated with the vertebra. Etiology would be HLA-B27 family history with the infection of the Klebsiella aerogenes. These are some etiologies. HLA-B27 family history and infection with the Klebsiella aerogenes. Pathogenesis would be genetic involvement and environmental factors that causes the overactivity of the interleukin 23 receptors. T cell activation do happen at the enthesis. Enthesis is the place where the ligaments and the soft tissue of the tendon to join with the bone. So genetic factors and the environmental factor will trigger the overactivity of the interleukin, that is 23 receptors, where the T cell activation to happen at the enthesis that causes interleukin 22 to be released, that is your osteoproliferation. TNF alpha that causes inflammation, that triggers inflammation. Interleukin 17 that is your bony erosion. Interleukin 22 that is osteoproliferation. TNF alpha that produces inflammation. Interleukin 17 is causing bone erosion. So osteoproliferation, that where the trauma happens and do fibrotic bone to happen. TNF alpha that produces inflammation, that erodes the annular fibrosis, that calcifies the annular fibrosis. Erosion of the annular fibrosis, calcification of the annular fibrosis, syndesmotic formation, that is your new bone formation, predisposes the bony ankylosis, that is your bamboo spine. So most commonly males are affected before 45 years, usually 20 years it happens. Chronic inflammatory low back pain, it increases on the rest and decreases by the movement. Deep-seated lower back buttock pain do happen. Restricted spinal mobility, chest involvement do happen, and restricted chest expansion and chest pain do happen. Peripheral joint involvement is 30%. Enthesitis and dactylitis is seen. Achilles tendonitis and plantar fasciitis too seen. In eyes, you can see anterior uveitis, acute asymmetric anterior attenuating uveitis. This is acute asymmetric anterior attenuating alternating uveitis. In CVS, AR and iotitis is seen. In RS, upper lobe interstitial pneumonia, secondary IgA nephropathy, and osteoporosis, and CNS cauda equina syndrome do see. ESR, CRP levels are elevated, rheumatoid factor is negative, HLA-B27 is positive, X-ray shows bamboo spine. Grading of the X-ray, blurring of the cortical margin, erosion and sclerosis of sacroiliac joint margins no longer visible, ankylosis. X-ray findings, bamboo spine with a square wave vertebra with sclerosis with a shiny corner sign, erosions, that is Romanes sign. Dagger spine, that is calcification of the interspinous ligament. Railroad, that is calcification of the joint capsule, and trolley track sign is a dagger with a railroad sign. Treatment would be physiotherapy. First line therapy is NSAID, and for the symptomatic relief, intraarticular steroids can be given. Enthesitis, that is steroid injection, and a peripheral arthritis, disease modifying agents against the rheumatoid disease, that is sulfasalazine, and anti-TNF alpha, infliximab, adalimumab is seen. For surgeries, severe restriction, you can do surgeries. Osteotomes can be done. Thank you.